which range all the way from simple surveillance up to very complex outbreak management. Those numbers vary from year to year based on circulation of communicable diseases and their epidemiology. The immunization program, which is a combination of directly administered shots for vaccines, monitoring of cold chain to ensure that publicly funded vaccines are appropriately managed, as well as surveillance of immunization status for children in schools, is a program which is also going through some very significant changes, which I'll refer to in a minute. The Environmental Health Service area. Okay, we're having trouble keeping up with the slides because of a technical problem, but I'm going to keep going. If anybody can assist with the technology, we'd appreciate it. Within the Environmental Health Service area, one of our largest programs is the DineSafe program for the inspection of food premises. That's a program that service levels are really determined by the number of food premises in the city and our ability to keep up with them through staffing levels. The last one that I'm going to mention is the West Nile virus program, which we didn't have up until about 10 years ago. With the arrival of West Nile virus in Ontario, gave us a role in mosquito control. And that's a program which varies in service levels according to the epidemiology of the disease. So when we see larger numbers of mosquitoes that are more likely to be carrying West Nile virus, we can ramp up larviciding efforts in order to control the consequences for human health. So I just want to highlight several of these programs, which, as I say, are facing particular challenges and how we are approaching those challenges. The first is the Student Nutrition Program. We have very good evidence for the benefits of this program, both for health and education of children, and Council has been very supportive of expanding the program so that it can reach all of the students who would benefit from it. The province has responded in kind and given us some significant increases in funding as well. We are still facing ongoing challenges with raising food costs that we need to address every year in order to maintain current service levels. And there are still schools with significant populations in need that do not have a program. Last year we had about 75 schools who applied for a program, and the funding was inadequate to meet it. So we want to continue to try and grow that program in order to achieve the benefits that we know are there to be had. Some of the opportunities for this program, I think it's become a very large program, and there are, I believe, significant opportunities for efficiencies in the area of food procurement and distribution. And I think there is an opportunity to increase private sector fundraising for the program. Some of the strategies that we've been implementing, there are two currently pilots of new ways of procuring food for the program and distributing it, and we're waiting the results of those pilots. We're also carrying out a governance review, and one of the reasons we want to do that is to ensure that the program has the governance that it needs for a future in which a higher level of participation by